All right, guys. It is, what time is it?
I don't know. On my phone. Like
It
9
is
something.
10 o'clock at night,
It is. It's 10.
and I have been out of surgery since 4 o'clock. And yo, I don't care if you're male, female, going through BBL, be ready, because it's a process. It's definitely, you had to, I'm glad I took the advice from the aesthetics as far as everything that I was reading to really mentally prepare yourself. Do a lot of meditation, breathing, CBD gummies. I've been a fan of taking those for a few months now, so they help out a lot with the mental side of things. But my appointment was at 10 o'clock this morning. And this is the one thing that I will say: if you are planning to go to Mia Aesthetics, be ready to wait. Like, if they tell you one time, don't expect that time. You're gonna be waiting a long time. And that's the one thing that I will probably say I'm most annoyed about. And if I knew that there was gonna be that much waiting involved, I probably would have booked my drainage massage somewhere else. But I'm gonna spend a week of waiting. So I went in at 10 o'clock, the time that they told me. I wasn't called back into the room in the back before they take you into surgery. It was like 11:40, and I literally was just sitting in a waiting room full of women waiting for drainage massage. And then from there, I waited an additional 2 hours. So I was in a room by myself. The nurses would come in and check on me. They had me change into the gown, the bouffant caps, the shoes, the stockings, the compression stockings, the whole nine. And finally the doctor came in. I got to meet Dr. Boker, who was absolutely fantastic. By the time he came in, I was already hooked up to the IV, the anesthesia. The nurse who put the IV, she was fantastic. I wish I remember her name. She was amazing. So I got to meet Dr. Boker. He came in, he did the markings on me. He was amazing at listening to exactly what I wanted. Obviously my fear going into a BBL surgery, and don't mind me, I'm swollen. Like, this is just all the anesthesia and the fluids they fill me up with. I feel like crap, but I felt it was important to do a video. But anyways, he came in, he did the markings, he listened to me, because going into BBL surgery, I was worried that they will be used to feminizing, doing the hourglass, the curves, the hips, the whole nine. And that was something I did not want at all. I didn't want the curves. I just wanted a flat stomach, get rid of the love handles, and get a soccer butt. So he knew exactly what I wanted. He was very great at repeating it back to me, giving me the reassurance that he knew what I wanted. So he did the markings and everything, and I felt confident. I was pumped. From that moment, I waited an additional like 40 minutes. Like I said, it was like 1, then they took me back at 1:40. The anesthesiologist came in. He was phenomenal. He was very informative, told me, because I'm asthmatic, he was gonna do the extra steps in monitoring me with my breathing, giving me the asthma treatment while I was put under, let me know what to expect and everything. So it was a quick process. From 1:40 they came in, they said, all right, we're ready. I had an opportunity to just send a quick text and not wait for that text response back, because they were like, just send a text and come on in. So I went in, they laid me on the bed, the table, they strapped me up, started giving me the medicine, and I was out like quick. Next thing you know, I was up in recovery room, and I was shivering, like it was like below zero. But obviously that's, the standard in the OR. And the nurses came in, the anesthesiologist came in, and they just wanted to tell me that Dr. Boker did an amazing job. Like, they were in awe. They were like super amazed by what he did. And they were just like, you're gonna love the results as far as what he did for you. So that made me super excited, but I was just shivering so much that I was like, somebody warm me up. Like, I need to warm up. So Dr. Boker came out, he, let me know what he did for me. He also was kind enough to walk me outside with the nurse. He got to meet Anthony, told him, everything that he did, and it was a great experience. So once you're in the back and you meet the doctor and they do the markings. Like, it's a great experience from that point, but leading up to that point, you have to have a lot of patience because it is stressful. Like, it was just a mess. Huh?
Madhouse.
Yeah, it was a madhouse. So I'm not looking forward to going in tomorrow for my post-op and drainage massage because I know they are expecting me there at 1, and I'm probably gonna be waiting a long time. And then I have 2 other visits after tomorrow because I paid for 3 drainage massages, which is what's recommended on the first week. And overall, it is a process. Like, you have to have a support system, someone who's going to take care of you. Anthony's been doing a great job so far. I'm so like, he's doing a great job. So the bleeding, be prepared for it. Like, my faja is covered in blood. So one thing I wasn't expecting, I thought I was going to be leaving out of there in clothes. No, you leave in your faja, no undergarments or anything, and your robe. Like, that's how you leaving. If you're a man, you're leaving free balling. Women, you're leaving with your hoo-ha out. Like, it's just, it is what it is. So I'll show you guys just a little bit, can't go too low, of the bleeding that is like, it just, I am covered below this faja with blood. So if you're squeamish or don't have someone that's able to take care of you in regards to this process, then it's probably not for you, because the dog pads, the pee pads, come in handy big time. Let me put my my pee pad back on. Yeah, like, yeah.
This is so, like, never ending.
That's nothing, because we've had worse pee pads than this. But pee pads, you're gonna need a ton of them. 4x4 gauze. I've also heard that maxi pads are good for the to be able to, like, put over the wounds, to
been more prepared
to absorb the blood. I think that would have probably been a good help, but again, I think my mind was like, I'm not going to no store buying no maxi pads. But if you're a guy going through surgery, do it. Get those maxi pads. They're going. I think honestly, they're gonna be helpful, so that you're not going through so many pee pads. But the pee pads, like I said, they have been great. I've stuffed the wounds with 2x2s. I put pee pads over it. I've been cleaning it, keeping a close eye on it. Well, not me, Anthony. And the towelettes. These right here are amazing. Like, I called my girl Lori, who bought these, and they are so good. They're gigantic showerless body wipes, because you can't shower until the day after you go to a post-op and everything. And they smell good, they feel good, they clean you up well. So this has been a lifesaver. So I highly recommend these for anyone going through any of these procedures, whether it's lipo, breast augmentation, BBL, whatever. Anything that's gonna be invasive, that's gonna cause the bleeding and you can't shower, this is great. So highly recommend that. So yeah, that is where I am at thus far. The pain medication are, they're starting to help out. It's been tough laying down on my stomach. What's been helping a lot too is they say walk, keep yourself moving. So I've been walking up and down the hallway in the hotel, keeping myself moving, not staying still, because the longer you stay still, especially this first night, the more comfortable you feel. And I definitely feel that after a while being laying down. So yeah, do you have any tidbits that you want to say?
Wear a red robe.
Yeah. I saw some women going in there with white robes, cream, pink. Like, get yourself either black or red, because you don't see the blood. And they were just walking all over with blood stains everywhere. And Child, let me tell you something. Not cute. It's not cute. I know the last thing you're worrying about is being cute, but if I spent all this money to go through this, I'm not trying to be walking around looking a bloody mess. Just like, no. So,
we talked about the floor.
highly recommend this. So, also, Anthony put down a shower liner on the floor because as I would get up from the bed, there was times that I was just dripping and leaking on the floor. So if you're in a hotel, like this is a brand new hotel that we're in, we don't want to be charged for a massacre being in here. So that was super helpful, putting down a shower liner on the floor. Also in the bathroom, a pee pad where, where I stand to go pee. So yeah, I will keep you guys posted. We'll see how I feel tomorrow morning and we'll take you from there and we'll keep you guys updated on this journey. So yeah. If you're thinking about it, I hope that these series of videos that I'm going to be posting are informative and that they are useful for men who are going through the BBL journey and just don't have a resource of looking up a journey of others. Because like I said, there's a ton of women out there, but not a lot of men. So I hope that this video is helpful for you guys and I will see you guys tomorrow. Bye.